As soon as I got to the to the United Kingdom, I was walking. I'm like, what on earth is ectopic pregnancy? It's a killer, and it's sometimes difficult to recognize. Okay, but first of all, follow me, and by the end of this talk today, you'll be able to understand what it is, why it's difficult to recognize in some cases, and once it's recognized, why it must be tackled out immediately. And in some rare cases, if we don't understand them, there are some things we can do to them to deal with them. Now follow me. So that is your womb, okay? That is your tubes outside here, okay? And that's your tubes on this side here as well, okay? Now, if you've had a C-section before, you've had a scar here. Let us put it away, black, a scar, C-section scar, okay? Ectopic pregnancy too can happen in cesarean section, okay? Scar. So, but follow me, I'll be talking about these things clearly today. So just quickly go with me. So pregnancy is designed by God to be in the womb. So let us put the pregnancy in blue and red. So this is the pregnancy in your womb, okay? That is where pregnancy is designed to be all the time, okay? That is where pregnancy is designed to be. 1 second. It's a call coming in. So that is where pregnancy is designed to be, in the womb cavity there, okay? So yeah, I had a phone call coming in, so I had to quickly call off that call. That's that. Now, any pregnancy, like I said again, that is not in the womb, okay, is ectopic pregnancy until proven otherwise. But what you must always remember, okay, is that there are some things that makes people prone to ectopic pregnancy. Number one, infections. If you've had infections before, like chlamydia infection, gonorrhea infection, all those type of infection, bacterial vaginosis, any severe infection that was not treated properly, that was not recognized, or that becomes recurrent, they can lead to damage in the tubes. If you've had one gonorrhea or chlamydia infection before, you have another one, 4 times, like that, 5, 6, 7 times, they cause additional and cumulative and extra damage to your tubes. One chlamydia infection not treated or not untimely treated, they add damage to the tubes. And what this chlamydia infection does, because chlamydia infection is the number one infection, commonest infection that damages the tube. See this tube, you can see this outside opening of the tube is open like a flower petal, waiting to grasp egg that is being released from your ovary. So this is your ovary on this side, this is your ovary on that side. So your ovary releases egg, okay? This tube is waiting to grasp the egg, sucks the egg in, and the egg goes in, and gets into your womb, and then meets the sperm to get pregnant and develops in the womb. So when you have an infection like chlamydia, it damages the tube, and the tube is not free to move, to grasp eggs, okay? So chlamydia infection causes like pores, like infection abscess pores around the edges of the tubes. So the tube, instead of being able to move freely like a crab like that, now it's stuck. It can't move. It's like that. It can't move. The tube can't move. So the tube cannot suck in egg properly. Apart from that, the chlamydia infection too can cause pores and infection abscess along the tube, what we call hydrosalpinx or tubo-ovarian abscess that is seen in PID. Chlamydia, gonorrhea are the number 1 and 2 causes of damage to the tubes amongst the PID organisms. There are many bacteria that can cause PID. PID is pelvic inflammatory diseases. There are many bacteria, many organisms that can cause PID, but the number 1 and 2 of them, their babalawo and mamalawo, is chlamydia and gonorrhea. The other ones too, but those two are the number 1 and 2 culprits of damages to the tubes and the opening of the tube. So the number 1 damage they cause is that they cause the tubes opening not to be able to freely move and attract and catch eggs to move into the tubes and get into the womb to get pregnant. Sometimes too, apart from the fact that they damage the opening of the tube cannot open and cut like that properly. Normally the tube is supposed to open and cut easily like that. It's stuck, it can't move. It's like this, it can't move. Apart from that, they even cause damage and blockage to the tube cavity so that eggs can't move. Or sometimes they don't even completely occlude the tube, okay? What they even do is that, let me show you. So this is the tube on this side, okay? What they even do is that they will cause damage, okay? That the tube is blocked So they'll cause a blockage there. Okay, so the tube becomes narrow and the eggs, okay, becomes stuck somewhere there. Okay, and the sperm, because they're aggressive, they'll go and meet the egg there, get the egg fertilized, and the egg will start forming a baby in the tube. That is where ectopic pregnancy results. Like I said again at the beginning, ectopic pregnancy can be anywhere outside the womb cavity. Mark my words, ectopic pregnancy can be anywhere outside the womb cavity. Ectopic pregnancy in the tube is in the womb. Tube is part of the womb, but the tube is not in the womb cavity. Ectopic pregnancy can be in a cesarean section scar, your old C-section scar. Ectopic pregnancy can be there. We call it CSC, cesarean section ectopic. But that ectopic is in your womb, but is not in the womb cavity. When pregnancy is not in the womb cavity, is called ectopic pregnancy. So play this video again and show it to your friends. When pregnancy is not in the womb cavity, inside the womb cavity there, inside the womb cavity here, okay, is ectopic pregnancy. It can be in the tube, it can be on the ovary, it can be in the C-section scar, it can be in the coronal region of the tube, is ectopic. I've seen ectopic pregnancy, they implant here. Okay, and they're even dangerous. We call them coronal ectopic because there's so much blood supply to the womb. On this side of the womb, they can bleed like a bomb blast. Coronal ectopic is dangerous, but the number one site of ectopic pregnancy, 95% of ectopic pregnancy, will be in the tube. So infections damages the cavity of the tube so that the egg can get stuck and then they get fertilized there. Okay. Now, what other things can cause ectopic pregnancy? If you've had maybe appendix operation before that was not properly done, that you now had infection abscess in your tummy following the surgery, okay? I'm not saying appendix operation causes ectopic pregnancy. Don't get me wrong, okay? Because I don't want to get a simple-hearted, wrong, and misconstrued. Appendix operation does not cause ectopic pregnancy. But if you have infections complicating any operation, for example, appendix operation, for example, even for example, fibroid surgery removal, if you have any operation that complicated or that was complicated with infection while you're recovering, pelvic abscess, causing an infection on top of the completed surgery, it can cause damage to the tubes, because the tube is also part of the tummy. The tube moves freely around your bowels. Any infection in your tummy, any infection in your bowels can spread as well to the tubes and can cause damage to the tubes. That is why if you have any infection around your tummy, it must be treated aggressively without delay to prevent damage to the tubes, which can be irreparable. Irreparable. So that is ectopic pregnancy. Now, if you've had a previous operation, maybe you've had your tubes blocked before because you're trying to do contraception, what we call bilateral tubal ligation, and your tubes has been clipped or blocked intentionally. If for in future you just say, doctor, I've changed my mind though, I want to start having children again, it's a bad decision. If you're not sure that you've completed your family entirely, don't go and get tubal ligation done. If you're not sure whether you finish having your family, don't get tubal ligation done. Tubal ligation is the same thing as sterilization of your tubes. Tubal ligation is the same thing as sterilization of your tubes. If you're not sure whether you finished having your family, don't go do that. Trying to reverse blockage in your tubes for contraception can be done through microsurgical techniques, but it's not always 100% guaranteed because that expertise, that all the instrument we need is not always available in Nigeria, and it can be difficult to reconstruct and to reanastomose your tubal ends that has been totally separated from such operation. If you're not sure whether you finish having your family, if you're not sure of your relationship, don't go and start getting tubal ligation sterilization done to your tubes. You can use other forms of reliable contraception that are reliable, long-term, and easily reversed in case you change your mind, you want to start having children in future. I hope I'm making sense here. So now, the question is that, okay, doctor, what do we do if you have ectopic pregnancy? If you have ectopic pregnancy in your tube, that tube must go away forever. Once there's ectopic pregnancy in the tube, the ideal thing is that that tube goes away forever. Because once the tube is damaged by ectopic pregnancy, you're bleeding, that tube must go. We call it salpingectomy. What ectopic pregnancy does in cases is that you see when you close the tap and there's water dripping tum from the tap, that's the exact same way some ectopic pregnancy behaves. Blood will be dropping boom. And why does that happen? As you have ectopic pregnancy, God forbid, the pregnancy needs to grow. They'll be getting bigger and bigger and bigger. They'll be stretching the tubes, okay? Only the womb is designed to stretch from size like this to a size of my head to accommodate baby in the body. That is why only women are designed to get pregnant. Men cannot never get pregnant. I mean, men born as a man that don't have womb. Don't get me wrong. I know there are other things about transgender things now. I don't want to get that. They're all over my head for now. I mean, it's beyond my understanding. No, I forget about that. So basically, the tube, if you've seen a tube before, is very tiny. Tubes are very tiny and they are not elastic. They don't expand. They are just a conduit. When you're driving on the highway is not designed for you to park. Even if you park and you move quickly. If you park on the highway, you're going to cause accidents quickly and you're going to cause death. The same thing too, the eggs fertilized cannot park and decide to be resident in the tubes. They must go away and go and stay in the womb. If you pack egg there that is fertilized in the tube, it will start to grow. And as it's growing, because the tube is not designed to expand, the tube will burst, pow. And once it bursts, we call it ruptured ectopic. Once the ectopic bursts, okay, because their blood supply to the tubes, the person will start to bleed quickly. And that person can bleed almost 1 liter within 24 hours or less. If you're bleeding more than 1 liter of your blood volume into your body, you are looking at death. Your body, a 70 kilogram human being, contains approximately 5 liters of blood. A 70 kg human being contains approximately 5 liters of blood. If you've bled 1 to 2 liters of your blood volume into your tummy from a ruptured, busted ectopic pregnancy, you've lost over 20 to 40% of your blood volume. And there's no way your heart will not feel that. There's no way your heart will not feel that. There's something leaking here. Imagine your pumping machine at home that is pumping water from your underground well. The machine is pumping water, but it's supposed to pump water, maybe a certain amount of water, and the overhead tanks get filled. But because somebody has opened a pipe mistakenly, because somebody has left a burst pipe mistakenly somewhere in the house, the water is leaking. The machine will keep pumping and pumping and pumping to compensate for that consistent loss. After a while, the machine coil will burn, and the pumping machine will stop working. The same thing too, if you're bleeding, they have to keep pumping and pumping blood. After a while, they have to be overworked, and the person will go into shock. From shock goes to kidney failure. From kidney failure goes into death. That is how ectopic pregnancy can kill. That lady I was talking about, I saw a lady. If you follow me on Facebook here regularly, I always mention about a lady that I saw that came with ectopic pregnancy about 3 years ago to an accident emergency here in where I work, and the person was already collapsed. The husband wasn't even aware that she was pregnant. She was collapsed at home, brought to A&E via ambulance. We didn't even know what's wrong with her because she was speechless and she was in coma, unconscious. So we took blood samples from her. The blood level was low. We did every test. Nothing was showing up. In the A&E, they quickly put a catheter in. As urine came out, luckily, she was still producing urine. She wasn't completely shut down. Because if she was shut down, we won't even get urine sample. We got urine sample from her, tested, pregnant, scanned immediately in A&E. They saw blood in the tummy. They called us in the O&G, come and see her. Immediately moved to theater, open her up. Open surgery. Blood was full up like oil well in her tummy. So she lost that tube. In fact, she was on dialysis for about 2 weeks, if I remember. probably. She was close to death, and she had mini strokes while she was on dialysis machine. 6 months later, fast forward, she's back again to normal. She was using a walking frame because she had a partial mini stroke on one of her legs, but she was healthy. Within a year, she's back to normal with the physiotherapy exercises. She's perfectly okay now, but she was close to death. In fact, she was at the fringes of death. It was luck and proper medical attention that brought her back to life. Many women have lost their lives in Nigeria because of ectopic pregnancy. I'm not abusing any health system. I'm just saying this. Now, how do you spot anybody, or how do you predict that anybody has ectopic pregnancy? Now, listen to me. Any woman that is pregnant has a risk of having ectopic pregnancy. As far as you're a woman, you're pregnant, your risk of ectopic pregnancy is there already. Take it from me. I'm not wishing anybody bad, but the fact is, once you're a woman, once you're pregnant, you have the risk of having ectopic pregnancy, because you might not know whether there's any damage in your tubes or not. It doesn't matter whether you've had a baby before. I'm not saying that you're walking up and down, you're living promiscuous life. No. You might be living the chaste life as a virgin. You might be living a chaste life as anything and honest with your husband. It doesn't matter. Anybody can have infection. And men, listen to me. Because your wife had ectopic pregnancy doesn't mean she's doing wayward life. No. Anybody can have infection. Anybody. Whether from sex or whether just by the infection moving into the vagina. The vagina is like an open wound. It must be treated with caution. That is why I get vexed and I get angry. I get angry when people put unnecessarily funny things, foreign body in their vagina during sex or even on their own. People put all sort of things like if their vagina is the Maggie kitchen. People don't have any respect or iota of respect for their vagina. They put anything there. People tell you to put this and this, you go and put in your vagina. Vagina is an open door into your tummy. It must be kept seriously sterilized and kept clean. With all due respect. So once you're a woman, you're pregnant, you've missed your period, you've done test of pregnancy, and you're pregnant, you have every possible risk of ectopic pregnancy. Just take it from me. What you must do is this, and follow me here as we move on, because it can be difficult to diagnose ectopic pregnancy in some cases. Because if you're less than 4 or 5 weeks pregnant, it can be difficult to see the pregnancy in the womb. In most cases, once you're about 6 weeks and above, we can see your pregnancy in the womb on scan. So if you are pregnant and you're having pain on either left or right side of your womb, of your tummy, and you're feeling dizzy, and maybe as well you're also bleeding, spotting, much heavier than the usual implantation bleeding that some women get, and you're having pain in your right shoulder, there's every chance you might have ectopic pregnancy. Again, you're pregnant, you're having pain either on the left or on the right side. Okay? You're feeling dizzy. You're having bleeding in your vagina, a bit heavier than implantation bleeding. People say, okay, how heavy is implantation bleeding? Like a smear of pink blood. But this time around, you're noticing blood slightly more than that, clear blood, consistently unwiping, or even dark old blood. Old blood, dark, is when your blood is there for a day or two, mixed with vaginal discharge, becomes brown as blood. And you're feeling dizzy, you're having pain in your right shoulder, there's increased risk of ectopic pregnancy within you. Immediately go to hospital, get a scan, and do a test called beta HCG. Okay? Again, watch this video. When you go to the laboratory, you tell them you want to do beta HCG test. Beta HCG. Okay? It's a blood test. And in that blood test, we call it serum beta HCG. It's also a test of pregnancy, but it's a blood one. The test of pregnancy you normally do at home is a test that you see 1 line or 2 lines. Remember, that's what you do at home. You put your pregnancy strip, You see maybe one line or two lines. Two lines, you're pregnant, one line, you're not pregnant. That is also a test to check for beta HCG in your urine sample. And that one, because it's positive, but this is positive or negative. That is a qualitative beta HCG. Because it's positive or negative. Qualitative. Remember when we're going to common entrance in those days, common entrance, we do exam in Nigeria, we call it quantitative aptitude and verbal aptitude or something like that. This one is positive, negative, is qualitative beta HCG, positive or negative. But the one I want you to do is the blood test of pregnancy, okay? It's called quantitative beta HCG, quantity. We're not just checking whether you have beta HCG like the urine test. We're checking to know the numbers. So we also call it serial quantitative beta HCG because we do it 2 times. And there's a reason why we do it twice. Follow me. Serial quantitative beta HCG is a test of pregnancy where we collect a blood sample of yours in the laboratory. We put it in a machine. We do it in our ATG laboratory. That's the first thing I ensure that we do there. But people don't appreciate these things. Now, what that does is that if you do that test today, for example, okay, we get a particular result. Let's say we get a result and we say that you are 1,000. Let's say for today's sake, 2,000, okay? The ideal thing is that if you repeat this test again within 48 hours of the first one, you should get at least somewhere between 3,400 to 4,000 or more. Basically, if you repeat the beta HCG, okay, it should be 66% or 100% total double more than the first one. I still remember when my wife got pregnant, the first thing we did then was to do a beta HCG to see that is it doubling. It's not just to know if it's ectopic, God forbid. It's also to know if it's in the right place and if the pregnancy is viable. I'll get to that. So it doesn't matter whether you've been doing something before or anything. Doing beta HCG is not to test whether you've been doing something wayward before. No. Like I said again, my wife did it. My wife is very good. I'm happy with that. Thank God. But I did it because any woman in the world has a risk of ectopic pregnancy. So if you do this test twice and it's not increasing more than 6%, okay, there's something wrong. It's either the pregnancy is not developing, that is to say, the pregnancy could be in the womb but not developing, not viable, or the pregnancy is ectopic pregnancy, which could be dangerous. How do I differentiate from the two? If you do this repeat test within 48 hours, and the second test, okay, is 87% less than the first one. So the first one is 1,000, or let's say 2,000, and the second one you did is about 500. That is a sharp fall, okay? That means that pregnancy is not developing well at all. Whether it's in the womb or even outside, it doesn't matter now because the HCG is falling down heavily, more than 87%. So the pregnancy is not doing well, whether it's in the womb or whether it's ectopic outside. Okay, so at least I know that the pregnancy is not doing well. It's outside. It's not doing well, whether in or out. But I've seen ectopic pregnancy too behave the same way too. The pregnancy is not doing well. Okay, because ectopic pregnancy too, they can miscarry. Very rarely though, but they can miscarry. Just like normal pregnancy too can miscarry in the womb. Ectopic pregnancy too outside the womb in the tube can miscarry. But what you expect is that the beta HCG is dropping. Okay, and in some cases, okay, the beta HCG is dropping, but it's become static. It doesn't drop further. It stops at maybe 400. It doesn't fall anymore. You see what's going on? I've seen a lady like that in Devonshire, in North Devonshire Hospital, then long time ago. She had a beta HCG of 150, but she came in on that Saturday morning feeling dizzy and some pain in her tummy. But I'm like, with this whole story, she's having beta HCG done. It was coming down, then it got stuck in at 200, 150. So we did scope that day. We did a scan first of all, blood in the tummy, camera into the tummy at the theater, blood there, and the blood in that woman was congealed, very like thickened blood, organized because it's been there for a long time. ectopic pregnancy, even at 150 beta ACG. So the fact that your beta ACG is coming down does not exclude you from ectopic pregnancy, but it just makes it unlikely. Okay, follow me. So it can be a bit confusing. So, but the most important thing you should take away from here today is that if you're having the signs I described earlier about ectopic pregnancy, pain in your tummy on one side, feeling dizzy, pain in your right shoulder, you're pregnant, if you had chlamydia infection before or gonorrhea infection before, sometimes you've never had any infection before, you're having dizziness, pain in your shoulder, you are at increased risk of ectopic pregnancy. Just the fact that you're a woman and you're pregnant, and you're even a chaste lady, you're a chaste person. I've seen virgins that have never done anything before. They got pregnant, they got married, they had ectopic pregnancy. That is why I told you that I did it for someone that is very close to me too. I checked their blood test. So the fact that you are so clean, you've not done anything before, you've never had any boyfriend before, virgin, you got married, does not save you from ectopic pregnancy. It can happen to anybody. I've seen it happen to wives of pastors before, and they were totally strict and chaste. So don't get me wrong. The fact that you have ectopic pregnancy doesn't mean that you are wayward. No, it's just life. Now, so what of scan? The problem with scan is that if your beta ACG is less than 1,500 or 2,000, we will not see anything on scan. Most importantly, if your pregnancy is less than 4 or 5 weeks, we will not see anything on scan because this pregnancy is too small. But if I did your beta ACG, if I've done your beta ACG, and your beta ACG test says that your pregnancy hormone is about 2,000, I would expect to see pregnancy in the womb. If I don't see it, I'll bring you back for a scan within a week or 10 days. And during those 10 days, I'll always tell you, don't stay at home on your own. Ensure there's an adult with you that can bring you to the hospital just in case you're feeling pain or you're dizzy or you're feeling uncomfortable, so that people are aware of the ectopic warning signs. And if these signs or symptoms develop, they can come to the hospital as soon as possible. Because sometimes this science is not pure science. Some things are like black and white. They're like Polaroid. You take a picture, it becomes clearer with time. So the same thing too with ectopic pregnancy too. It can be a bit unrealistic, can be a bit confusing, can be a bit not clear. So that if you're going to take away anything today from this lecture today, number one, if you're a woman, you're pregnant, you are at risk of ectopic pregnancy. You've done a test of pregnancy, it's positive or negative, ectopic pregnancy is there, risk. Get a scan done. If you're less than 4 or 5 weeks pregnant, scan might not be very useful at that stage. Then in that case, do beta ACT test. And another one, 48 hours. The test after 48 hours should have a 66% increase in numerical value, number value, compared to the previous one. Number two, if the beta ACG is falling down, it's 7% decrease from the first test, the chance of ectopic pregnancy is lower. Not totally gone, is lower. And even if you have ectopic pregnancy at that stage, the chances are that it's probably miscarrying on its own. In very rare circumstances where we can't find the pregnancy, we've done scans serially, we can't see any pregnancy in the womb, but your beta ACT is still up there, sky high, not coming down, we might need to give you medication called methotrexate injection, which helps to dissolve ectopic pregnancy wherever it is. And even in some cases too, we've done an operation to remove the ectopic pregnancy, but there's some pregnancy bit of the ectopic left behind, which we can't find. We'll give this injection, methotrexate, which helps to shrink any leftover ectopic pregnancy wherever it might be. Okay? But that injection, we only use it for you if you're not bleeding. If we can see the ectopic pregnancy heartbeat, if you are stable, if we know that you can always come back for checkup. We don't give that medication if we think that you will not come back or follow up, because that medication might need to be given extra dose again. That medication too can slightly affect the liver and kidney. So if you're a person that has liver problem, we will not be able to give you that medication in some cases, depending on, we have a set criteria. So these are the things about ectopic pregnancy. Now, on Facebook here, I can't see any comment though. I'm sure, okay, yeah, comments are coming up now on Facebook. I couldn't see them earlier. Now, before I continue, let me take some questions from people. They will continue a bit if we have more time, okay? I can see you here following me on Instagram. Thank you so much. Wonderful people. Unfortunately, on Instagram, the names there are sometimes unpronounceable. There's a lady asking a question. She's saying on Instagram that, doctor, can an ectopic pregnancy miscarry on its own? Yes, without going to hospital. Can someone that had a ectopic pregnancy get pregnant normally again? Yes. And she's asking me the symptoms of PID. Like I said again in my discussion, ectopic pregnancy can miscarry on its own, just like normal pregnancy do miscarry. But you cannot decide that on your own. There's no way you will know that this ectopic has miscarried though. So you can't know that on your own at home. You gotta go to hospital and let the doctor scan you and follow you up. And they will do your beta HCG, serial blood test of pregnancy, serial quantitative beta HCG, to see and to monitor your hormone level. By doing that, we might be able to know if that ectopic pregnancy is being miscarried, but it's not what you can determine on your own at home. If you've had ectopic pregnancy before and one of your tubes has been taken away, you can still get pregnant normally, yes, naturally. The fact that one tube is gone, does not drop your pregnancy chances by half percent, 50%. No. If your tube is gone on one side and the other one is still perfectly okay, you can get pregnant from that leftover tube 67% overall. In some cases where both tubes are damaged and you have ectopic on one tube, what we usually do is that we try and preserve the leftover one, despite the fact that it's damaged. What we do is that we just do what we call salpingotomy, where we just open the tube slightly and we remove the ectopic pregnancy. And after doing that, we now give you the injection methotrexate to shrink the ectopic pregnancy. IVF is a common reason why people have ectopic pregnancy. I don't know why, but IVF is one of the risk factors for having ectopic pregnancy. Somebody said, even with open tubes, infection-free, is there a risk of ectopic pregnancy? Yes, like I've been saying. People that have never had infection before, that have open tubes, yes, they can have ectopic pregnancy. Once you're a lady and you're pregnant, you have that small risk of ectopic pregnancy. Trust me. Somebody is saying that, can uterocil cause infertility or damaged tube? No. That's on Facebook. Doctor, can a pregnancy be transferred from tube to womb? So if you have ectopic pregnancy in your tube and we discover that, we can't move the pregnancy into the womb. No, we can't. Science has not gotten into that level yet. Somebody said, can someone be pregnant with partial tuber blockage? It's possible. But if you have partial tuber blockage, the chance of ectopic pregnancy is so high. With a damaged tube, a partial tuber blockage, the risk of ectopic pregnancy is very high, almost 70%. That's for Oluchuku on Facebook. Doctor, what causes pregnancy test not forming well when it's in the womb? Usually chromosomal problems or failed implantation. Somebody said, okay, and also you need to know this, endometriosis of the tubes. When you have endometriosis in the tubes that is damaging the tubes, it also causes an increased risk to the possible damage in the tube. If you have endometriosis on the tubes, okay, it also damages the tube. The tube cannot move freely. If you see my this tiny ceramic model, you can see endometriosis on the tubes there. Sometimes they can even be on the femoral end of the tube, so that this opening of the tube cannot move freely. That can cause and increase the risk of ectopic pregnancy as well. Signs of PID, offensive discharge, pain on both sides of tummy, feeling feverish, and having pain during sex. Those are one of the commonest causes of signs of PID. Okay. Doctor, I went to laboratory twice for blood test pregnancy. The results came out positive, but when I gave the result to my doctor, he referred me for scan. Which scan came out negative? How possible? So you had blood test of pregnancy, you say your positive test, okay? You don't scan, it says negative, because probably your scan was too early. And like I said again in this discussion, if you get pregnant and you do scan within 4 to 5 weeks of pregnancy, it might not show. Because it's not showing on scan doesn't mean you're not pregnant. Like I said again, you can be pregnant, and if you do scan too early in pregnancy, it will not show on scan. Okay? How early can ectopic be detected? In most cases, ectopic pregnancy will be detected around 5 weeks of pregnancy to 6 weeks, because by the time your pregnancy, from my experience, so by the time your pregnancy gets around 5-6 weeks size, the tube cannot accommodate them anymore, and the tube will burst. And once the tube bursts, 2 seconds, everything bursts, is bleeding, can cause death within 24 to 48 hours. Can a man with low progesterone go for IVF? Yes. Thank you. What is the best medicine to treat infection in pregnancy? Infection in women, something. There's no one antibiotic to treat in all infection, because infection, like you know, can be caused by many different organisms. So to treat this infection, my job is first of all know what organism is causing your own infection. And once I know that, I'll be able to give the specific antibiotic to tackle that specific infection or other specific bacteria that is causing that infection in you. So there's no one medication kill all. We're not babalawos. We are scientists. We are doctors. I'm not babalawo. We are scientists. We know first, then we now move second. Thank you. Thank you, Chidima, and all our moderators for approaching and also for answering questions here. After ectopic pregnancy operation, what next? Very good. So if someone has an ectopic pregnancy and we've taken out the tube, no big deal. As far as the other remaining tube is perfectly okay, you can still get pregnant. Like I said again, as far as that leftover tube is perfectly okay, chances of pregnancy is almost 67%. So what I'll do for you after you've healed, 6 weeks after the ectopic pregnancy, or maybe 2 months afterwards, we can do HSG to check the patency, to check the health, to check the functionality of that leftover tube. Once we've done HSG and the HSG is fine, that's fine. We let you start trying to get pregnant. But as soon as you get pregnant in your next pregnancy, we tell you, once you get pregnant, call us. We start doing regular scans, maybe every week, to spot the pregnancy where it is, to know if it's in or outside the womb as soon as possible, in case it's a ectopic pregnancy, and then we can act and take the best action if it's so. Sir, can once tube start dripping blood, does this mean, yeah? So if you're bleeding from ectopic pregnancy, if you have ectopic pregnancy on any tube, that tube is damaged, is gone. That tube must be removed in most cases, okay? Somebody is saying, what is unstable lie on ultrasound scan? Unstable lie means that you're pregnant, you're about 30 weeks pregnant, 40 weeks pregnant, or 36 weeks pregnant, and the baby's head is down today, is sideways tomorrow, is head up today, head up tomorrow, lying like this today, lying, so baby is changing. That's unstable lie. That's not ectopic pregnancy, okay? That is unstable lie. Somebody is asking, does endometrioma cause infertility? It can. Endometrioma is endometriosis on your ovary. For you to have a large endometrioma or endometriosis on your ovary, you're probably having endometriosis too on your tubes. And in such cases too, they will damage your tubes. So having endometrioma means that you already have endometriosis. And that endometriosis is on your ovary. For you to be that severe to have endometriosis on your ovary, that means that you're probably having endometriosis on your tubes too. And it's possibly damaging your tubes, which can increase the risk of ectopic pregnancy. Someone is asking, what causes ectopic pregnancy? Don't worry. I guess you're late. Watch the video over again. I've explained in detail from the beginning what can cause ectopic pregnancy. So just watch the video, Chioma from beginning, Chioma Ugamadu. You see all the discussion and everything I've said about what causes ectopic pregnancy. Estrella Ayaba is saying, when someone miscarried an ectopic pregnancy without medical assistance, does she need DNC to cleanse the womb before another pregnancy? Yes and no. It depends. The reason is that if you've miscarried the ectopic pregnancy and the doctors have told you that they've done scan, your blood test of pregnancy, and your doctor told you, you didn't tell yourself, oh, you can't tell yourself that. Your doctor must do that and tell you convincingly that you've miscarried the ectopic. If that is the case, you don't need the DNC. Okay? But if we think that you might have had what we call heterotropic pregnancy, where pregnancy is in the tube and in the womb at the same time. I've seen people twice in my lifetime, but no, twice so far, I would say. I've seen what we call heterotropic pregnancy, where the pregnancy is in the womb and another pregnancy in the tube. So basically, the woman had twin pregnancy, but one pregnancy is in the tube, another is in the womb. It is very common in IVF pregnancy, where there'll be one pregnancy in the tube, ectopic, and another one normal in the tube and the womb. Okay, so if your ectopic pregnancy is miscarried, you don't need to have DNC. Thank you, Dr. Dixon, my Oga, Dr. Dixon Yobosa. I salute. Thank you so much, my boss. Thank you. Someone's asking a question. Can a 10 centimeter peniculated fibroid cause infertility? Yes and no. Okay? Yes and no. A 10 centimeter fibroid is quite big, possibly occupying the whole cavity of the womb. In my opinion, if you're trying to get pregnant and you have a 10 centimeter fibroid in your womb, remove it. There's no joke about it. And it must be removed by a skilled surgeon through hysteroscopy. Okay? If it's in the womb cavity. If it's outside the womb, it should be removed by... So if it's outside the womb, it's unlikely to cause infertility, but it should be removed. A 10 centimeter fibroid is too big enough to accommodate in your body. Millicent, I've answered your question. Let's answer other people. Okay? Chuma, just follow the link given by one of our team members here to join the premium services. Chuma Ogechuku Ogamadu. Thank you, my wonderful, beautiful sister. Chuma Ezene, I've answered your question already. Thank you, Chuma Ezene. Remove the fibroid, okay? Remove the fibroid. Can someone that does not see ovulation white get pregnant? Yes. Like I always say, ovulation, looking for ovulation white is a waste of time. Looking for all this egg white thing in vagina for ovulation is a waste of any woman's time. Whoever is giving you advice to be looking for egg white, that person is wasting your precious time. You're either ovulating or not. Not all women ovulating will see egg white, and not every woman that's ovulating will look for egg white. Prince we'll talk about ovulation another time. For ovulation seminars, we've talked about it everywhere here. Ovulation is on our page consistently. We'll talk about it again. We've talked about it so many times. We'll get it back again to that sermon again. Okay? Thank you guys for joining today. I hope you watch this video over again to get the answers and more information at your own free time. Once again, happy weekend and have a wonderful weekend ahead. God bless you and see you soon. Bye-bye.